Perhaps you've seen the story about Giuliana Rancic returning to work following her mastectomies. This brings up a really interesting question that I'm asked by patients. Dr. Harness, when can I go back to work? What are my limitations of work? What can I do? How am I going to feel about myself when I go back to work? Well, first of all, most importantly, people need to be given time to heal following their surgery. As I've shared with patients for years, I do the surgery, you do the healing. So that healing times vary all over the place. Also, the motivation of the patients vary all over the place. And then, of course, there are different kinds of mastectomies. There are mastectomies with reconstruction and mastectomies without reconstruction. And once the drains are removed after the mastectomies, patients find their mobility increases tremendously. They're more up and about, moving around quickly, etc. When it comes to the reconstruction after mastectomies, generally it's done in two phases, where the first phase is the placement of a tissue expander, which is done at the time of the mastectomy, and then followed a few months later by the placement of a permanent implant or a delayed rotation flap or something of that sort. So the question about when can I return back to work has multiple variables to the answer. How motivated are you? What's the extent of the surgery that you had done? A variety of factors like these. Are your drains out? But what do I encourage? And this is really the bottom line of this video response. The bottom line of what I'm trying to encourage patients to do is to get back as quickly as they can to feeling normal and whole about themselves. And if getting back to work, such as in the TV industry, can be done easily and quickly, more power to those individuals who can do that. You obviously want to use common sense. The healing process takes many weeks, but also part of getting back to work and having reconstruction after a mastectomy is also part of the emotional reconstruction process that I've talked about a lot at Breast Cancer Answers and also at drjharness.com. So get back to work early. Use good common sense. Obviously, check with your surgeon that it's okay to get back to work. Be thinking positively, and I think returning back to work early is part of the positive attitude that I want patients to have, which certainly leads to better healing, better outcomes, better feelings about oneself, and just go for it. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.